everybody, my name is Samantha Lisboa. I'm a physiotherapist and Pilates instructor, and many weeks ago on my stories on Instagram I promised you that I'm going to teach you how to do trigger points for lower back pain and also for a piriformis syndrome. So basically what you're going to need is or two balls like that is quite hard. You can have also a tennis ball or a proper trigger point ball that is basically two balls glued on each other. So if you have separate balls, you just need a sock. I already teach this in other videos. You can just wear the two balls inside of a sock and give a nod and or use a ball like that. So let's start. So we are going to start with the double ball set up a little bit high, more in the thoracic area, and then we start to release each point till we arrive on the lower back. So many muscles here on the top, around our thoracic, going to refer pain for your lower back, and the most of the time the problem is more there than exactly on your lower back. So let's start. Put the ball in the middle of your mat, and I want you to get the end of your shoulder blade and count more or less 2 or 3 fingers above that, and it's more or less this line here. You can bring here with your fingers to see where exactly is more sore or more pain, and it's exactly there. Then you're going to set up your ball. If you're going straight to the mat, you can also get the line for women, the sport bra line, or middle of your ribs, of your thoracic, and then you're just going to hold that position a little bit. It's important that your head is aligned with your spine and your shoulders are relaxed. And here you breathe in for your nose and breathe out for your mouth. From here, keep the pressure against the ball. Look, I'm doing a little bit pressure here. You're going to hold this pressure. Arms on your side, you're going to push against the mat and you start to lift a little bit your hip, and then you lower, and then you lift and lower. We can do this movement 5-10 times. And after here, we are already going to roll the ball like 1-2 fingers, or more aligned here with your last ribs. Again, arms on your side, head aligned. Make sure there is no tension on your neck and shoulders, and a little bit pressure against the ball. So all these, you need to make sure that you have a really good point, then you're going to refer the pain to your lower back, or if it's just local, how is this pain? If it's a hot pain, or if it's just like a knife and come quite fast and go away fast as well. And here again we start to lift and lower. Remember to keep the pressure against the ball, arms on your side, push against the mat, and here we are going to move another 5-10 movements. And then you can release a little bit. Again, we are going to roll the ball a little bit more lower. Now align with your belly button. You're going to have the ball. Press again against the hard ball. Hold there for 30 seconds more or less, or till the pain starts to release. And on here, different than when we have the ball a little bit higher, we are going to start just lift your sacral. So think your tailbone is going a little bit up and then you lower. You see the movement is really small. It's just your sacral, just the tailbone, you lift and lower. Keep a nice breathing. Arms on your side, you push in the mat. Take off the ball off your lower back. And now we are going to the piriform muscle, minimum glute, and also the median glute. So you're going to start with the ball straight, align here with the bone of your hip. So top the ball like that. See, it's straight, align with my hip. On here, I'm going to put my arm to support my head because I'm going to lift my hip and lay down on my side on the ball. So here I have my neck very relaxed. Try to don't do any contraction with the muscles. Normal because it starts to bring a little bit pain or a lot pain sometimes. And it's natural then we do some contractions with the muscle to try to avoid the pain. So try to relax the muscle, try to leave the weight of your hip against the ball and hold that position. You can hold for 30 seconds, you can hold till you feel that the pain starts to release. Try to notice where is exactly the pain, if the pain goes to your leg or if it's just local. Keep your breathing. On here we start now just a little bit. Twist to open your chest and keep your pressure there. Again, relax your hip, lift the weight of your hip against the ball. And then you can breathe out after 30 seconds. Return all. The ball more or less in the same way. This time I'm going to turn more toward to my glute in a diagonal. You see here the difference? So no more straight, in a diagonal. And then again, I'm going on the ball. I turn on the ball. Relax again your muscle. And this way we start to get more the median glute. Another 30 seconds or till you feel then release the pain. And then you're going to return. Do the other side. Still, if you have a pain just in one side only, do exactly the same to the other side. And then after that, no ball. You're just going to cross one leg over your opposite thigh. Engage your core to bring this leg here in a tabletop position. You can also here hold with your hands. In my case, I have my left knee and my left glute stretch. So I want to push my left knee toward to my right foot, and I want to pull my right knee toward to my chest. And in this way, I start to feel a nice big stretch here on the side of my hip. and hold this position for 30 seconds. After that, open your arms in a T position, and then you're going to twist, turn, drop your legs to the right side. You can touch the mat, touch the floor with your left foot on my case. Breathe out, engage your core to return your legs. Put your foot down. Do exactly the same with the other side. And always mind the way to lift and sitting. Again, I really hope this video can help you, can help your friends. Don't forget to subscribe on my channel, like, comment this video, tell me how did you feel with this technique, if it really helped you, and we'll see you next. Bye bye.